The Ministry of Health, in collaboration with the World Health Organization (WHO), on Friday commemorated World Mental Health Day in Banjul, bringing together stakeholders, health workers and mental health advocates to raise awareness and promote collective action on mental well-being. Observed globally on October 10 each year, World Mental Health Day seeks to educate the public, reduce stigma, and mobilize efforts to improve access to mental health care and psychosocial support. Speaking at the event, Mam Jara Marenga, National Mental Health Program Manager at the Ministry of Health, underscored that mental health is not a secondary concern, but an essential part of public health. She noted that many communities continue to grapple with mental health challenges, which required sustained attention and investment. She noted that over the past 3 years, the ministry has been training healthcare workers nationwide to integrate mental health care into primary healthcare services. This initiative, she said, aims to better equip health professionals to effectively respond to mental health crises and emergencies.
So I call on all of us as a country that we should commit to having mental health and psychosocial support component in every emergency preparedness and response plan, whether it's national or at the regional level, whether it's within the Ministry of Health or outside of the Ministry of Health, for example, the disaster management program. And remember, when you have a mentally healthy population, they become productive. And also remember, there is no health without mental health.
Aji Jacob Njai, a mental health survivor, shared her personal journey with the audience. She recounted that at just 16, she became a teenage mother, an experience that profoundly altered the course of her life. Thrust into the responsibilities of parenthood at a young age, she had to confront challenges for which she was unprepared. Speaking with honesty and courage, Ms. Njai described the judgment, fear and trauma she endured, recalling moments when she felt invisible and misunderstood. She admitted that for a long time, she did not recognize her struggles as mental health issues because she was still managing to attend school and fulfill her daily responsibilities.
Today, I am a living proof. I have smiled in class while crying inside. I have helped others while struggling to help myself. I have learned that asking for help is not a weakness. That's why I want to say thank you to the doctors. They didn't just judge me. They weren't patient. They were patient with me, kind and understanding. When I broke down, they didn't just rush me. They listened. They reminded me that my story wasn't over. So now, from my journey to my experience as a mental health patient, and now to my turning point from pain into purpose.
The WHO representative noted that this year's theme for World Mental Health Day serves as a timely reminder of the urgent need to protect mental well-being before, during, and after crisis. He added that WHO is intensifying its efforts to ensure that by 2030, at least 80% of countries in the region have established mental health support systems. Currently, only 10 countries have dedicated budgets for mental health, with regional spending averaging less than $0.50 per capita.
To truly protect our people, governments must commit greater resources and accelerate integrated integration of mental health into emergency frameworks. To accelerate progress, the WHO urged Ministry of Health to establish multi-sectoral mental health coordination mechanism, strengthen community and social support system, train frontline responders in psychosocial first aid, expand mental health services, and uphold the rights of dignity of people with severe mental health conditions.
Also speaking at the event, Turkey's ambassador to the Gambia emphasized that mental health is essential to human well-being and should receive greater attention from society. He noted that perceptions surrounding mental health and mental illness must be challenged as they continue to pose significant difficulties in many countries, including the Gambia. He further stressed that ignoring mental health issues will never provide a solution to the challenges they present.
As development partners of the Gambia and sister countries, we have to support in every field this smiling coast of Africa, and of course mental health is a cornerstone of the health of a society.
The event served as a reminder that mental health affects people from all walks of life. As Ms. Njai's story illustrates, mental health challenges often go unnoticed, particularly among young people and mothers who silently endure emotional pain. Reporting for Kerr, Fatou, I am Makutumane.